Well, after those perfect medical protocols and research, we will try to pass to another medical and psychological treatment, which usually it goes in combination with necessary medical treatment. Well, I don't need to show something, so I'm going to sit and have better possibility. So, okay. So, well, the drugs are necessary and very used and for right reason. Some years ago, when I was medical director of UCB Hellas, Greece, we have been working very well with those protocols. And if we want to make psychotherapy to someone, very often in severe cases, we need absolutely to have drugs in the beginning and maybe continuously. But drugs normalize thinking and comportment, but cannot create new skills for the patient. So that's why we need to combine very often drugs and psychotherapy. And firstly, drugs to reduce severe symptoms, and secondly, psychotherapy. The very little psychotherapy in the beginning, usually, is just to create a relation with the patient, to have his cooperation in the discussion we're going to begin and the exchange of ideas in a daily basis. Can I have a little silence from those there, please? Thank you. Well, it's important, the relation, because even if someone is psychotic or epileptic or whatever, is a human, and he has feelings, and he has the possibility to have a relation with the other, with the therapist. But the therapist must be patient and win firstly this cooperation of his patient, and we never know how long the duration of this therapy. We know that if someone goes better, maybe we'll change the place. Firstly, will be in clinic or in hospital. Secondly, will be in external day hospital or consultation. And thirdly, will be in psychotherapeutic group, maybe, who can be also in the beginning, but there may be a change of group, what we're doing usually. We begin in the institution, we go out in another outpatient institution, and maybe we will go in an association group or in a private group to continue. But if we have a good result in the sense of good neurotization of the patient, which means good capsule of neurotic comportment of the patient, then we can have a contract for some years continuous therapy. To do it for years, we have to be sure that someone we have a complete construction of the therapeutic environment, and there is no problem, whether of money, whether of interruption for no therapeutic reasons, the therapy. Because when we enter in deeply involving the patient therapy, we must be there as long as it takes. This is the ethics, as you know, and we must be there until he is able to go alone, and he decides to go alone in life. Usually we know that going alone, it will be not really forever, but it is someone's decision to try it, and we respect it, of course. And I would like not to be very long in introduction, because I would like to have discussion of cases also with you. For instance, day hospital care, that means not obliged to do it in a hospital, not obliged to do it in an institution. You can do it in a place that you can assume all day, 8 hours, how do I say, all day, presence in contact with the patient. For instance, example, lately, recently, I had been with a young patient, very neurotic, very depressive in that moment. He was depressed years ago. He had made use of drugs for especially hashish in a long period of his life. He finished with that when he began therapy some 6 years ago, and he took antidepressants, especially the antidepressants that the colleague said before, and he was very well, and he was working in his mother's restaurant. But in the same time, why he was very well, not only the psychotherapy, but the fact that he knew a young girl and she had been with him, and thus was a stabilization reason for several years. But last year she left after a fluctuation of their relation. So I have to point out that all these years he was coming only half of the year for therapy and half of the year during touristic period, because the restaurant was a touristic island, Corfu, and he was there with his relation and not far from his mother's restaurant where they were working together. And suddenly he came again in a mess because he lost his somehow psychotherapeutic relation, because he was stabilized from the young girl with whom he was living. And also he was working every day in his way, half working, just keeping under surveillance the money, the clients they were paying in the restaurant. And sometimes when it was better, he was better, work with the other things of the restaurant, not very important things. But the mother was very happy, the young girl was very happy, and he was half of the year coming with his girl, his wife, let's say, because usually it was together. And we were making a couple meeting to explore how it goes, their relation. Sometimes it was with the mother to give some advices how she had to stay with him, to take distance, because the fact was, after all this year, that he was very dependent from his mother, because his father was someone working in ships, and even when he stopped working from ships and be absent for many years, he was someone who was looking like a person that actually is working in the ship and doesn't care what is happening in his family. So we had an absence of father figure in the mind of this young boy, and in reality he was very in touch, a little psychotic borderline case with his mother's total power, because it was a mother capable to do many things and give work and money, make money for all the family and for all the workers in the restaurant. Well, finally when this broke down, she came catastrophically depressed, and we gave him escitalopram as a more effective antidepressant to get him up. And in the same time, we made a project of 4 months day hospital, ergotherapeutic day hospital. So he was painting the shop, the restaurant of his mother. So we found a place that he was working in painting, a place who needed to be painted, as he knew this, and he was in touch with us every day. So it was a day hospital-like work every day, not being in a hospital place or an outpatient professional place, which is a risk. You have to be sure when you do something like that. But it had been very successful, because day by day a little by the amelioration of his depression by the citalopram, who is more effective, and usually with a little aprazolam together, because the only thing we can have with the citalopram is augmentation of the anxiety, so you have to give something for the anxiety. What we are using usually is aprazolam, who acts in thinking and not making down his motility or his awareness, because he was working and he had to be often in a high wall, so it was important to keep the control. Well, we were not very far from what was happening, but it was important that he can be able to control himself. And little by little he began to laugh and everything began to be better and became optimist. So he found another girl, a higher level girl, and he began a new relation who had some difficulties, but he got higher level of satisfaction because of the higher level of possibilities of the new girl with him this time. Well, this often, you know, we see in psychotherapies. People need to come higher and higher to be satisfied. When you have a depression, you begin in level A, you have your depression, you go down, and then it's not enough to go again to the previous level, you have to go higher. This can be stable, to go higher. If you stay in the same level, it's not enough. When you have neurotic structure, or when you have neurotic superficial structure, but a good superficial neurotic structure, because otherwise the transference or the relation, to say more simply, is difficult to be established if the other cannot say thanks, cannot say I want something from you, I want to see you more often, or this week I have something other to do, so please let me come in 15 days. And you know that what he describes is true, and so you can trust him. Because it's important always to trust the other, but be sure that you can trust. So know him enough to be sure that there will be no bad surprises. Because when we are not anymore depressed, we have to be sure that we are not, the other is not anymore depressed. If there is some few depression and he forgets to take his drug, or he forgets to call us, because telephone is important also in psychotherapy, in modern psychotherapy, to reassure him or her if there is a doubt for something. If we don't use that, we can have in the middle of the night, for instance, to run in emergencies because there is a TS, for instance. Usually, when we have a good neurotic, superficial, but good neurotic superficial possibility, there will be not very dangerous. It's usually a call to help, a call to be with him, to be present, one way or the other. Well, this is an example. If you want to discuss more, I'm ready to do. Otherwise, I will be in another example.